thank you all for your patience. And this part won't be interpreted, but I wanted to let you know that even though we will be recording, none of you will be any of the recordings that we share. Those of you that are participating, we will make sure to that your voices and your pictures are not part of the recording for your privacy. So we will share the recording so that people can see the information, but we will edit it so that just the PowerPoint and the presenters are in the recording. So just in case some of you are a little nervous about being in recording, we will be very careful and promise to protect your confidentiality.
Thanks, Elaine. I'm going to start the interpreter channel now. Okay, go ahead, Damon.
All right. Hey, welcome to the NAACP Eugene-Springfield NAACP committee. This is a health committee's subgroup training committee on promoting self-advocacy and health literacy and patient communication. Today's June 25th. Communicating with your provider is the session today. If you missed session 1, it is recorded. It will be posted somewhere for people to be able to go back and review at a later time on the NAACP website. I hope I'm not making that up right now. So Susan, please keep me honest. In the meantime, I want to thank our sponsors for this training series that we're having, or this webinar series that we're having this time. Pacific Source, Lane Community Health Council, as well as Trillium, and of course Trauma Healing Project. All of these organizations were a big part of allowing us to make this presentation today. So this webinar series is a 6-part series. We've been doing it on Saturdays from 10 a.m. to 11:30. So once you register for this, each time the next session will come up, you'll actually get an opportunity. You'll actually get an email with the link in it to go to the next session. So you won't have to continue to register over and over again for it. But like I said, this one is about communicating with your provider. The next one on July 16th will be about selecting and working with healthcare providers. June 30th about feeling safe and valued as an individual with the patient-provider relationship, making sure there's that trauma-informed care going on with that patient-provider relationship. August 6th is also another big one. It's about managing mental health. That's something that's really a big focus area for health plans, and as well as like just the healthcare system in general, right, from OHA. The last session, we weren't being lazy about it. We weren't like, hey, to be determined, we're just going to figure this out as we go. This is really about kind of taking the information from the earlier series and finding the things that were really key points that everyone wanted to discuss and talk about, and just make sure we're reiterating these things to make sure that everyone feels like they left this training series with the tools they needed. So the format here is it's a great flow today. So how we do this, well, each time that we're going to do our series here. So we'll start off with the panel discussion, right? And they will talk about their experience in the healthcare system and and just a conversation back and forth with the moderator here. We really like people to share their stories about what they've gone through, and what their thoughts were about those situations. Because what we learned is a lot of times we've all had similar experiences, or there are people out there that had similar experiences, or wish they would have known some of the information today, right? The presentation will come from a professional addressing the session topic today. Today we have Iris Bicksler. She is from Pacific Source. She's a traditional healthcare worker liaison, and have been a actual traditional healthcare worker in the past. So she has this experience of being an advocate for people in the community, which is like a great person just to have here, much like we did last week. Small group discussion discussing amount of participation, just allowing people to kind of get back together and maybe just talk through maybe, your experiences or how we could have, or how this information may have helped you, or, where you'll take it in the future. And so, again, today's webinar will be communicating with your healthcare providers. The things that we'll be covering is asking questions and getting information in a format that you can understand about your rights to have information about your diagnosis and treatment given to you when and how you need it, right? So not just giving you information, but making sure it's information you can understand. You don't want to get out of the doctor's office and they just gave you a whole bunch of paperwork that just looks like a lot of gibberish, right? You want to make sure that they're giving it to you in a way that you understand it. And the role of the healthcare navigator in supporting you and communicating with your provider and getting the information you need. So basically just another resources and tools that are out there for you to make sure that dynamic with you and the provider is one that's healthy, right? So it is I'm your moderator. I'm Hawkins. I am the chair of the NAACP, co-chair of the NAACP Health Committee. I am also the health equity specialist at Trillium, and I'm on the training committee. The panel here, we have TC Dumas, who is here. She's also on our training committee. We have Susan Bliven here as well, and we have Scott Davis here. And of course, we have Iris Bicksler, sorry, Iris, traditional healthcare worker liaison with the Pacific Source Lane CCO. So we really, I'm telling you, our panel is really passionate about self-advocacy for themselves and as well as for others. They are very smart. They are very very open about their experiences, just to make sure they're helping other people along, which I love and I really appreciate that. And of course, our presenter is also a very bright individual from our community that really cares about supporting the people in our community. So let's get ready for a great session today. And I apologize if I've blown through this. I worried that we were a little behind, so I just want to make sure we have time at the end. So small group discussions and reflection will be about 7 to 10 minutes. Again, about, what did you learn today from the webinar, or that you wish you would have known before, what's going on, what you're going to do with the information presented today, to do things differently next time with the doctor's appointment. How will you, share the information you learned today with others, friends, colleagues, members of your community. I know for myself, I genuinely like to take the information back to my family. It is things that we just take for granted, that are things that are supposed to be available to us, resources for us, and how that dynamic of the relationship is with the provider is supposed to be. So I hope you guys all do the same. Last but not least, a special thanks to our NAACP Health Committee training work group here. It's a lot of folks within here from our community. As you can see, their names and the organizations they're with, that you can tell that there's a lot of people within this community and in these organizations here that give people as resources to allow us to support the community with trainings and or webinars and things like that for here. So I just want to call out really these folks from our training committee, just so you guys know that really we're thankful for them, and we're thankful for the organizations that allow them to come out and be a part. So with that said, I am now, you're like, Damon, but you blew through the entire spiel. I'm like, yes, I did. I will stop sharing and we'll get to our questions here. I was like speaking super fast, so I apologize. I'll try to be better for next time. But let me start just at the beginning here. We'll focus on TC here. TC, I just, want to know, can you tell us something about your experience communicating with providers? Maybe a story you had to share and that maybe went well or didn't go well?
Well, I'd have to say, I'd have to start with my childhood. I've had a lot of experience with providers, and one memorable one that set the stage for a lot of my my future dealings with healthcare professionals was when I was 10 years old. I got 11 stitches in my knee. And the doctor told my mom that he had deadened my knee, and so that I wasn't feeling any pain. And so I was screaming, but I wasn't feeling any pain. So I learned that my mom told me to be quiet because I wasn't feeling any pain, but I was feeling pain. So I learned that to take this hurt and this pain the same way that I did, the other pains that I had, like with belts and switches and fist or whatever. I was supposed to take it that way without any protest, and that to realize it wasn't hurting me. So silently.
Yeah. So that, the provider basically telling you like, no, it doesn't hurt. You don't feel pain there. So yeah, it's tough when you're telling the provider how you feel and they don't receive it. I had a similar situation with, like I said, I went in for my back was hurting and they asked me what my pain level was. I told them it was an 8 or a 9, but I said it so calmly they thought I was lying. And so he just took my legs and swung them off the gurney, and I screamed at the top of my lungs, and he slowly picked up my legs and put them up and gave me the strongest pain medicine that they could give me. But I was not very happy about that. But it was that not respecting, like, hey, like, there's taking your patient at their word. And I think that's something that we have to do.
Right. It's like they're the expert. And I believe, especially like if you have a label like diagnosis or misdiagnosis or something like that, then that's what they see. And there are certain things that people that have that diagnosis are supposed to feel, think, and do. And so you are treated according to that. And you basically, are given different treatments based on that. And a lot of times you're not given a choice or voice. You don't have rights anymore once you have that diagnosis in many instances.
And I know that you are a also peer support, I believe, as well.
Yes, I'm not a paid peer support, but I have taken peer support training, as well as been a paid mental health care worker in the past.
And so when you've advocated for people, have you seen people have similar instances like yours that you've had to step up for?
Yes, I've actually helped a lot of people who have not, have just been treated as their diagnosis. They have not been asked things. They have been told what to do, and not known that they even, in some instances, they did have a choice. And I was kind of like not looked at as very favorable, because I'd let them know that you don't need to have this happen to you, and that you do have a choice, and you can say no, or you can go to another person or something like that.
Yeah, awesome. I appreciate that. What about you, Susan? What about, I'm gonna actually ask you a different question. Given that we all have the right to be given information about our diagnosis and treatment plan, right? And ways that we can understand it. What would you like to tell people to let them know about how to exercise that right?
I think that sometimes, I think it's just knowing that they do have the right, that it is important to know they have the right, because and that no matter how limited they are, like whether they're, having some mental health symptom that's really difficult for other people to think that they have, that they can understand, then they still have a right to, voice, and they still have right to information to the capacity that they are able to understand.
Yeah, I definitely think that's super important. Yeah, thanks, TC. I appreciate your responses there, and I know you are a big advocate for people in the community, particularly in your personal community, that they even come to you. So I think that is great, being there to provide that information. Susan.
Hi,
Hi.
I have over 20 chronic diagnoses and see over a dozen specialists. So I really have a lot of experience in communicating with different doctors. I also have memory loss. So I have to be very structured in working with doctors. I start out by making sure that I'm prepared to understand what they can tell me. I may have a notebook that I have the date, the provider, what my concerns are, and a space for what that we've discussed or what I want to discuss, and then what we've actually discussed, because they're often not the same thing, and then a space for what do I want to talk to this person next. This way I can keep on track with my doctor, because I tend to wander a little bit and talk about the things that I'm thinking about at that time. I have things written down, like I said, that I need that to be able to discuss what needs to be discussed. I always make sure that there's somebody with me when I see any provider. That way I can know what was said. They can help me ask the questions I need to ask. And I have that moral support. So I have a family member, a friend, a traditional health worker, or somebody there who can advocate for me. When I have a diagnosis, I ask the provider what my options are. More testing, medication, procedures, or what? I keep asking questions, or Lee, my husband, who's usually the one with me, will ask the other questions if we don't understand what's going on or what we can do. I always ask the doctor, what would you do if it were you or someone you loved? And it's surprising how often the answer is different than what they've been pushing me to do.
That's very powerful. Just that one alone. I'm sorry to interrupt. I just want to interrupt because that's really powerful. Just kind of making it more humanized. Again, thinking of it in the sense that it's not just a patient. It's a person, and it's somebody's mother, somebody's daughter, somebody's wife. You see what I'm saying? Somebody's sister. So think about it when it's your family member type deal. It's a great way to do that. One of the other things that I thought you said was, becoming prepared with notes for the doctor. I think that's something I struggle with myself. Like I go in there, and because I am a shoot the breeze guy, want to talk to the doctor and just, hey, how you doing? How's everybody going? By the time we get around to like what's really going on with me, I've forgotten half of what I really want to talk about. So I do think that's such an important part of that. Have you, I mean, have you had an
¿Has,
instance where
has tenido
the,
incidencias cuando...
oh, I can hear the Spanish translation.
Yeah, hang on just a second. Can we take just a second? And it'll
Okay.
go back into the interpretation. All right, you can I'm sorry to interrupt, but go right ahead now. They're back in their on their channel. Thank you.
No problem. Have you ever had a time with a provider where like you just didn't like what they were telling you and it just rubbed you the wrong way, and then you had to address them at some point about that?
Oh, yes. That happens a lot of times because doctors have their own agendas, and it's not always the same one as you have. I know there was one time when a doctor was telling me that what I was experiencing wasn't real. You know, he told me it wasn't possible for me to have the reaction that I was having to medication. And he refused to listen to me or my husband or my caregiver, who all saw that reaction. Eventually, because he wasn't open, I had to get a new provider because we'd become adversaries instead of working together for my health. Most of the time, though, if you talk to a doctor, they really want to help. And so if you can make them understand what's going on, they're willing to help you. It's like a few months ago, I was with a doctor and I take opioids for pain. Well, I told him that I knew I wasn't addicted because I can go without them. And as he was leaving, I thought he said, "That's what they all say." And I was devastated. I'd been with this person for years, and I thought he believed me. So it was another month, and I was stewing, and Lee was telling me, "No, that is not what he said. You misunderstood." Well, I thought I heard what I heard. So before we got started the next appointment, I looked at him and said, "Do you think I'm addicted? I heard you say that's what they all say," when you left. And he leaned towards me and said, "I'm so insensitive." And he took my hand and told me he was sorry. No, he never meant to say that. And then we had a good discussion about what it would have looked like if I was truly addicted and what he would have done had I been addicted. He said he would have been with me the whole way and got me through treatment so that I wouldn't be. And then we would have found another way to address my pain. Now, that was the best experience that I've had with a doctor because he not only understood what I was telling him and how I felt, he felt badly that I had that reaction and that I had felt betrayed.
Yeah.
And it wasn't until we had our discussion that he turned to Lee and started telling him that he was sorry. And Lee said, "That's not what you said. That's what she heard."
So that is so awesome. So two things came out of this, right? So one, you had the courage to confront the doctor and say, "Hey, like, if you said this, I don't think this was right," right? So that was a really good thing. The other really good thing out of that was that you had Lee there, telling you like, "Hey, I don't think he said that. This was what I heard," right? And so there's again, like you said earlier in our conversation, that it's good to have that other person there to hear things in the conversation that may have picked up things that you may have missed or hear it differently. So, but Susan, I can tell that you are like a super strong person there, because you were like, "Hey, I don't think this is right, and I think you need to fix this." So yeah.
And that's it exactly, because I needed to have that fixed before I could go on with this doctor, because otherwise it would have destroyed our relationship and I wouldn't be getting what I needed from him.
I appreciate you telling these stories right now. and just and walking us through like what you do. I think those are good tools and resources of how to be with your provider. I think you know, and understanding your rights about that is very important too, and I appreciate that. But standing up for yourself or being advocating for yourself is really something you have to do, right?
Yes.
And I really appreciate you know, your thoughts on that. Uh, you know, I'm going to ask Scott here a question next. Scott, sir, how are you doing today?
I'm doing very well, thank you.
Good to hear. It says, you know, so from your experience communicating with your providers, what do you wish you would have known earlier? Or, you know, what have you learned that you would like to share with the group today about communicating with your provider?
Well, first off, I'm going to just introduce myself real quick. My name is Scott Davis. I am peer support at Oak Supportive Housing for the HIV Alliance. I'm a former injection drug user, and you know, I guarantee you, I had a lot of trauma going to the ER by the way I was treated by medical professionals, not being listened to, sometimes being thrown out before I even had things addressed. People use tough love on you that you don't even know. They aren't even part of your life. So was real difficult when I stopped using drugs, and I had AIDS by that point. So I had a lot of work to do on my health. And what I've learned is the day before I go to see any of my practitioners, I sit down and make a list of 5 questions that I want, or 5 things that I want covered during that meeting. Because when you go to the doctors anymore, they go right in and they sit at the computer. And it's like, here's your 15 minutes, go. So if you have those, then you can ask a lot of the questions. And if you don't understand what they're telling you, ask questions back or say, this is what I heard you say, if you really don't understand. And that way they can correct it or expand on whatever they're telling you. But these kind of things really, really, really help me when I go see a provider.
Yeah, so and you mentioned the thing about the provider sitting at the computer and kind of typing away, right? And you're not even sure if they're listening to you. Actually, I you know, coming working for a health plan, like I actually see complaints coming about that. And a lot of times the providers just they're putting in their own notes, like you know, before they were writing them down, but this time they're typing them in as you go. But nevertheless, it does feel like, you know, it's just a kind of level of disrespect, like, hey, I'm telling you about what's going on and you're just not even looking at me, right? So how do you deal with them, you know, like you even said, like they don't believe you or they want to throw you out?
Fortunately, now that I don't use drugs, I'm not an injection drug user, I don't really have those kind of experiences the way I did. Generally speaking, I kind of realized that because that's how medicine has changed over the years from when I was little and doctors made house calls. That's just, for me, it doesn't really bother me because I know that they are listening, but I do understand a lot of people have difficulties with that. And, you know, just try to, you know, ask him questions. And if you want him to look at you, you can also ask him every now and then, hey, can you look at me? And I've never had anybody not look at me if I ask them to.
Yeah. So, you know, sometimes you feel like they're in a rush because, you know, it's like a 15-minute slot, right? And you're in and out. And I think people don't understand a lot of times, you know, the clinics, you know, when they've gotten you in there, like they've gotten you in here for this space, and then the doctor has to get to the next room and the visit for that. So, you know, asking for that extra time, has that been successful?
Yes, yes. If if you go through the questions, usually there's something in there that they're going to want to talk to you about as well. And so if you have the questions, then you get the time.
And I'm going to go back and off script just a bit with the three of you, because I just realized that this is something that is becoming more common than not. And just for the folks here today, this is not, let's beat up on the provider. So definitely not that right now. This is more about like just that we're kind of pointing out the instances with providers that seem to be common issues that allow people to, advocate for themselves with the provider. So in this case, the question is, have any of you ever gone in and the provider wasn't aware of your current health situation? Like they hadn't read through your chart before coming in the room? Because I've had that issue with a family member, and to me, it was life-threatening. So I just want to know, did any of you three have that as well?
It's been rare, but it has happened with me. Either they'll address something that happened a long time ago, or they didn't review their notes and don't know what is happening with me now. Most doctors, though, are very good about reading the last few notes and knowing what's going on. But if they don't, then I don't have any problems with saying, no, that's not what's happening now. This is what we need to address. And sometimes you have to be firm, but most of the time you'll be listened to.
And TCE?
I had a provider that I eventually I did feel safe enough to not have it to let go. And she kept making a lot of mistakes like that, where she didn't read the chart, or she would say things that weren't like I had been in, been in rehab for my back surgery, and she didn't know that she says she didn't know I had been in back surgery that I had had my back surgery. So she asked me, did I have it? And she was the one who prescribed all the warfarin, the blood thinners for me while I was there. And she kept making mistakes such as that. And so I felt unsafe enough and had enough fear to change providers.
Yeah, that's and Scott, what about you, sir?
I saw a psychiatrist, and I had been on the same mental health meds for quite a while. And I have ADHD, and I'm on a stimulant medication. And because of my past, even though I'd been on this medication for 6 years successfully, they were going to put me on a medication that didn't work. And they were not listening to me that I had tried it and it didn't work. So I had to get a new provider in that instance, because sometimes you will get a provider that says that they know best, even though the medication that they want to put you on, you've been on before and did not work.
So to the three of you, so obviously if there's like an encounter with the provider and it's basically where you're trying to correct them on like your health or, your history or, just something, their attention to you in the room, and they take it as a like, hey, well, how dare you, confront me? I'm sure, that is out there too. Or, in my case, the provider, my mom had an MRI and there was a tear in her hip. She got the result, the provider got the results back, but hadn't looked at it for several months. My mom was now asking about it. And when she finally looked in the chart and saw it, she saw that there's this huge tear and she actually needs physical therapy for this, right? And And then I asked her because it was a televisit, and I asked the provider because I was shocked that she didn't know. I said, I'm under the influence right now that you just found out her results from the MRI right now. Like, this is the first time you saw it. And my mom had seen her several times since. And she was like, yeah, I just saw it right now. I was like, well, how is it that you just saw it right now? Well, she says, well, your mom didn't tell me that the MRI was done. And I was like, well, so let me get this straight. The MRI that you're looking at in her file in your system, you're blaming the patient for not letting you know that it was there. I was like, you don't patient blame on things like this. This is not her fault. This is your fault for not looking at it. That means you've seen her several times since then. So you haven't reviewed her chart at all. You see what I'm saying? To see what's going on. And she was taking the relationship with my mom for granted. And to the point, so after that call was over, I had to tell my mom, like, it's time for you to change doctors. This is not a good doctor for you because she is not valuing your health by, not going back and looking through your records. Every doctor I've ever known, from my experience, I used to hear them outside the door going over your history with their assistant before they walk in the room, or reviewing the chart as they're walking in the door, because they want to have some backdrop to understand how to treat you sometimes. And if that's not the case, then they're not all in. And so I had her, change doctors, and my mom's health was deteriorating. And she changed doctors, and she is like a 70% better than what she was under her previous provider. So it really does make a huge difference. We have about 10 minutes left with our particular section here. I think I'm going to go back up to one of the earlier questions, because I think you all had answers. Actually, TC, learning how to advocate for yourself, particularly for, I say it from our community. There is like, and even from the older adults community as well, there is like a level of respect of like, oh no, the doctor's too busy, or you don't dare question the provider. How do you help people through that? Understanding like it's not necessarily a disrespectful thing, but it is a way of making sure you're advocating for your own health.
Well, after many years of going through things myself, where I let things happen to me, like I let not let things, though things happen to me, like I was given electroshock therapy. I walked around with a broken foot. I had atrial fib for years. I had a degenerative spine and I had a lot of pain from that, and all that after going around with all that. And then I was advocating for people, when other people had those types of pain and those types of things happening to them that were, pretty cruel and unnecessary. Sometimes I would speak up for them, and I would try to, I think it was unjust. And I think that, they should have a choice and they should have a voice. So I, would, help them. And so later on, then I was able to turn that to where I was able to, to do that for myself, and to start, questioning and start, saying no, and start changing providers and start figuring out ways to make my appointments with my doctors better and do some of the things that Scott and Susan were talking about.
Casey's right. I found when I was an advocate, when I was still working, it was really easy to defend my clients and to get what they needed from providers. But when it came to me, it was more, well, it'll be all right. And it took me years to be able to speak up for myself. And that's one of the other reasons why I bring somebody with me, because I know how much easier it is to advocate for someone else. It's odd, but women are taught that we're supposed to help other people, but we're not supposed to help ourselves. That's we learn that that's selfish, and who wants to be selfish? So if you need somebody to go with you, that's okay, because we are taught to help other people. And sometimes we need the help ourselves and don't know how to get it.
Yes, I had a small stroke, and had I not had somebody with me, I was actually at a meeting, and I was going to go home, and I was told that no, I'm taking you, to the hospital, and because of that person being there and speaking, and letting them know that what I said was true. So basically, what I had to say was not, didn't mean anything, but much, but then, because I had somebody saying that this happened and that happened, it's like, oh my gosh, yeah, so we will do some tests this time, and we will, oh, wow, small stroke. Okay, go to the hospital. But other than that, I wouldn't have, if it hadn't been for that person, I would not have, I would probably been sent, I wouldn't have went. I was going home to go to bed. I wasn't going up there to the hospital to be subjected to that kind of treatment. But I was convinced that I was basically taken by my friend.
Very nice.
I think it's
Got-
self-protection to go ahead and say, I'm going to go home, because you don't want to go through the emergency room. You don't want to be treated badly or dismissed. It's much easier to protect yourself when you're in your own space.
Definitely. Oh, and what about you, Scott?
For me, sometimes you can't have someone go with you, and there are those instances. And for me, I always just keep asking questions until I understand.
Did they ever get tired of your questions?
I will just keep well, if they tell me something and I don't quite understand it, then I'll just keep asking questions until I understand it.
I love it.
Do you have them put it in writing? I know that I often do, because when I get home, I may have thought I understood it there, but I won't understand it when I've had time to think.
I get a treatment plan a lot of times, and I actually look at it and I take it with me so that I know what to do.
That is so awesome, guys. And just, we have a few more minutes left before we move over to the presentation part of this. And I don't want to bash providers, because I think they do great work. Most of them overall, I think they are overworked and a lot of times undervalued. So I don't want to leave it in that sense. And I do want people to understand there are a lot of really good providers out there. So I would love for you guys to give like an example, maybe of just one really good provider that you knew, that you had, and that just have that experience with them, maybe in like 2 minutes or less. When I first became a manager of people, they asked me, well, you never managed before. How are you going to manage? And I was like, I've had really bad managers, and then I know I don't want to do what they did. And I've had really good ones, and I want to do what they did because they really helped, develop people. Likewise, like, each one of you can kind of take a minute or so and just talk about maybe one really good provider and what it was about them that made them really good to you.
For me, the PCP that I have now, she just, I believe that she's trauma informed. I believe that she is a listener. I mean, and that she doesn't see herself as the only total expert she wanted. I seemed like she encouraged me to speak for myself, and that like I really had something to say. She acted as if she wanted me to learn about me from me, rather than from a report that was sent over to her. And I really love that.
Love that. Absolutely. Scott, Susan, which one?
Okay. I'm very fortunate in the providers I have now. They listen to me, and they let me know that I'm a person, not a diagnosis code. And I think most providers are that way. They go into medicine because they want to help. And sometimes the time restrictions or other restrictions get in the way. but I do believe that most people who are in the medical field are there to help.
Awesome.
Agree.
And Scott,
Well, when I was first diagnosed with HIV, I had MRSA and I almost lost my leg. And a few months, and I had it for 3 years. And I lost my insurance and my job. And my general practitioner, who had been my general practitioner for years, continued to treat me for free because I had no money. So I owe my life to a provider who took the time to treat me with compassion.
awesome. You guys have been wonderful. You've been a great panel as usual. You guys are rock stars. I appreciate it. I think hopefully, people not only heard your stories, but understood, some of the things resonated with them about their own experiences, but also how to, be able to navigate that relationship with the provider. So I appreciate your time there and really love your participation today. And hopefully, as we break out into like little groups later on, maybe people ask you questions like, "Hey, Scott, how would you have did this?" Right? It would be great to hear as well. So thanks again. At this time, we're going to transition to kind of Iris here. Iris has been listening as well, and she'll kind of talk about things, how to how to advocate with that provider, that communication piece there, and just other tools, and maybe even weave in some of you guys' experiences as well. So with that said, Iris, come on board here.
Hello, nice to see you all. Happy, beautiful Saturday. As Damon said, my name is Iris Bicksler. I'm the Traditional Health Worker Liaison for Pacific Source. I appreciate you all being here. I look forward to continuing this conversation. And thank you to TC, Scott, and Susan. Really inspiring stories. So thank you for sharing those. I do have some slides, so I will attempt the technology to share my screen here. Let's see. How is that working? Can I get a thumbs up? All right. So I've lived in Eugene most of my life. Was born actually in Crestwell. Raised 2 kids here. My partner is an elementary school teacher. I was trained as a birth doula back 27 years ago. I can hardly believe I'm saying that. Graduated from U of O. I ran a nonprofit called Doulas Supporting Teens that I co-founded with some other doulas here in the community for many years, and that's kind of the experience I'm also a community health worker, and like others on the panel, have taken a peer support specialist training. I have a background in nonprofit management. I've worked for a school-based health center, affordable housing, you name it. So I've been around the block a day or two. And look forward to sharing some of my stories. So today I want to talk a little bit about traditional health workers. We've heard them mentioned a little bit today and want to just level set about what they are, some of their benefits. I just want to touch briefly on the role that I have as a liaison within my CCO. And then I'll talk a little bit about what doulas do and are, and tell you some of the stories that I have, and then go into some recommendations. So traditional health workers is actually an umbrella term coined by the Oregon legislature about a decade ago. And there are 8 specific workers under that umbrella. So listed here, you can see they are birth doulas, community health workers, peer wellness specialists, peer support specialists, family support specialists, youth support specialists, patient or person health navigator, and a tribal traditional health worker. So again, all of those types of providers are under this traditional health worker umbrella that's really part of Oregon's care transformation strategies. But what are traditional health? They are trusted people from their local communities who share lived experience. And so what traditional health workers do in their community is help folks navigate complex systems They connect them to resources. They empower people to be their own best advocate. And they support someone's overall health and wellness goals as that person defines it. So each worker type has a little bit of a specific kind of scope and what they do. But suffice to say that, again, that overarching theme within all of the traditional health worker types is really that support and navigation with the emphasis on lived experience. I'm going to pause a little bit. I know we have a translator. I probably said that too fast, so I'll try to slow down a bit. I wanted to talk a little bit about some of the benefits. There's actually quite a bit of science on how traditional health workers are serving our communities. So because a lot of traditional health workers are culturally and linguistically specific, they share that lived experience of being from the culture or have the language of the people that they're working with. We see that reducing health inequities. So when you're working with someone who understands you from that perspective, they can actually support your intersection, your engagement, your ability to engage with your own health. Because often traditional health workers have that shared experience, there's an easy rapport. There's an easy way that someone can meet a traditional health worker and say, gosh, there's kind of an instant trust. And so that really helps, I think, in navigating the healthcare system when you've got a buddy to kind of come alongside you through your health and wellness journey, because you trust one another, you understand one another. So just to let you know what my role is as the traditional health worker liaison, I help support the traditional health worker workforce out in our community, connecting them to training, helping support their certification through the state. I educate providers and provider offices who are interested in having traditional health worker staff come on board. So we talk a lot about the importance of supervision. What does it mean to supervise a traditional health worker? So really making sure that any providers who are looking to hire traditional health workers understand the importance of appropriate, what we call reflective supervision or trauma-informed supervision. So I do a lot of that work. I work with the Oregon Health Authority and other people within my health system to really make sure that our members, that our community has access to all the traditional health worker types. But what I'm really here to tell you about is my experience as a birth doula. But first, what the heck is a doula? We gotta go through that in order to talk more. So a birth doula is someone who offers emotional, informational, and physical support to someone during their pregnancy, birth, and after the baby is born. So they are trauma-informed, they're evidence-based, they help provide resources and connect them to social services. They go to where the person is. So they home visits person wherever they're comfortable in being connected to. Sometimes it can be a coffee shop or a friend's house, but the idea is that the doula goes to the person that they're working with to just reduce the barrier of having to ask them to transport themselves. And so to be in a comfortable environment for them to meet up is really important. So they meet with them when they're pregnant, and then they go with them and support them throughout the delivery. And so that can be at a hospital, a birth center, or a home birth. And so one of the questions I often get is, what's the difference between a midwife and a birth doula? And just to emphasize, birth doulas do not provide medical care. So they are there just for information, just for physical support, and really to support the emotional part of having a baby. But they are not like midwives. Midwives are more like obstetricians. They're the medical care part of the scenario. So back, as I mentioned, back in 2003, I worked with some other doulas to start a nonprofit called Doulas Supporting Teens. And so we provided birth doula care for free to any pregnant teen in Lane County. These are actual pictures of clients that I had back then. I am sharing these pictures with permission. These pictures were actually published in a midwifery magazine. But I just wanted to share a few stories, not necessarily about the people pictured here, but of some of the clients that I've had. So I had a client who, at the end of her pregnancy, really started to not feel supported by her provider. And she was concerned that this provider was pushing her into doing things that she wasn't comfortable with. And we had a lot of conversation about what it meant to have a provider who supported your choices as a pregnant person and looking at the delivery. And she ended up changing her care provider a week before having a baby, which is a pretty big deal. She'd been working with this provider most of her pregnancy, visiting with them, monthly and then weekly, and really had that care established. But she really, at the end of it, was not feeling comfortable anymore. So as the birth doula, it was just my job to talk about her options. The fact that she had options was a big part of the conversation. You get to choose who you hire. You are actually in the driver's seat on this one. You get to ask to have a provider that supports you in the way that you're needing to be supported. So she ended up changing providers at the last moment. I think only had one visit with that provider, and had the most beautiful birth. She felt very supported by this provider. This provider gave her a lot of information about her options at each stage, and really was the right fit for her. And she had a very successful delivery. I had a client once who had some trauma history, and it was really, really important to her that she be touched only when she allowed the person to touch her. So even as the doula myself, anytime I went to go touch my client, I asked permission. That was a very important part of her journey. And she was really kind of scared to tell her provider that she needed that. But we kind of coached about it. We talked a lot about it in her pregnancy. And at one of her prenatal visits at the end of her pregnancy, she had the courage to tell the provider, I really want you to ask before you touch me. And during the delivery, the baby's head was crowning. The baby was about to be delivered, and it's the time where most providers are you've got several nurses, you've got the provider there ready to catch the baby. It's kind of an intense moment, and most providers are just kind of in their zone. They're kind of focused on baby, and so in that moment, I saw the provider remember that it was important for this patient to be asked if it was okay to be touched. And she looked up at mom and she said, is it okay if I touch you? And the mom said no. And I didn't know what was going to happen. And the provider said, okay, you tell me when you're ready. And there were a couple of pushes where most providers would be pretty involved physically at that moment. And I saw the look on that mom's face and the healing that she was able to receive, because she said no and someone said, okay, you tell me when. And it was a couple of pushes later and she said, okay, I'm ready, you can touch me now. And baby was born just fine. But I think, those stories for me highlight the importance of self-advocacy. Me having supported people during their pregnancy, it's such a vulnerable moment. And it's the time, I think, especially for young people in that moment, that it's important that they learn their options. It's important to learn they have a voice in their own care, because what, you know, in my belief and what I've seen is that makes them really good parents. They get to see what it means to work with their provider, because later they're going to do that with their pediatrician when their baby has an ear infection, and then, you know, later when their baby becomes a teenager and they have to you know, work with the provider in well child exams. All of that earlier, you know, in their pregnancy. So I really had the opportunity to support people at that moment in becoming their own best advocate. The other thing I'll mention too, and you can see in these slides, there were a lot of times where my client had a partner involved, and I really felt like that was an important piece of my doula role, to get that provider to include the partner in the experience. Especially as a young teenage dad, there's a lot of nervousness. The majority of them had never been to a birth, and so their kind of natural place was kind of scared in the corner, and it was important for me to include them in the process. Come on in, let's see what we can do to get you engaged, and that too developed their ability to be a dad, to get involved from that moment of supporting the person who is delivering their baby. So what are recommendations? So many of you have talked about this. TC, Susan, Scott, it's really been powerful to hear your stories. So I just really am more reiterating what you have already said, but come with questions. So important. Susan, your organizational skills sound amazing. I think I'd like to learn from you. But really the idea that that you come to the appointment with questions. And I even recommend, as the provider's coming in the room, mention you have questions. They might actually talk to you less and save room at the end if they know that you have come with questions. So I think it's great to have them come in and you say, you know, nice to see you again, or nice to meet you. I have 3 or 4 questions. I'd really like to be sure we leave time at the end for me to ask. So set everybody up for success. It's okay to ask a doctor to repeat themselves. If you don't understand, ask. We haven't gone to medical school, right? I haven't gone to medical school. Sometimes the things they say can be complicated and detailed. And if we don't understand it, then we just have to ask again. Tell me that again. So really just being okay with knowing that you might have to ask for them to repeat themselves. And as others have mentioned, write things down or ask, you know, for your care plan. Be sure you're leaving with something that you can refer back to. So as your doctor is talking to you, you know, sometimes a mile a minute about the prescription, and 3 days later, and then call me in 5 days, and all of the details, right? You're going to want to make sure that you write that down, because oh, did you lose me for a minute?
Yeah.
But you got me now.
Got you now, yeah.
Okay, sorry, we had a little bug in the system. I was just saying, favorite question, what are my options? Really important to ask at each stage of care, what are my options? Ask for what you need. I think it was you, Scott, who was saying, you know, once I've asked the provider to look me in the eye, they do. But sometimes they just don't know that you need that. So it's okay to ask for what you need. And so many of you talked about this. You are the expert of you. You are the person who has lived with you the longest. So whether it's the back pain that you're feeling, you know, or the emotions that you're having, you are always in charge of you, and you are the expert of your own care. And then the last thing I'll say is just knowledge is power. And ask your provider, where can I get more information about that? If you're feeling like you're confused about what the diagnosis is or what the medication options are. You know, get involved in your own care by educating yourself. So asking about where you can get more information is important. So I wanted to leave time for questions. Damon, we have anything in the chat? What do folks have questions about?
Yeah, so and that was great. I appreciate that, Iris, your presentation today. Thank you for coming in and joining us. I didn't see any questions in the chat, but I know we were going to go out to some of the offer the breakout room option as well. I just want to point to one really powerful thing that you said in there was about, you know, the pregnant mom just not being uncomfortable with the provider at the and near the end of her pregnancy. And, you know, a lot of times people can feel trapped, right? And that they cannot switch providers or anything like that point. In this case, you were able to coach her and advocate for her and understand, like, this is, if you don't feel right, you can move on. And because this is, you know, this is very important. And so thank you very much for that. I appreciate that, you know, you coming in and speaking to the group here of just the tools of how to advocate for themselves. As a small group discussion, and I see people were running away from us. But if anyone wants to kind of have a reflection of maybe 7 to 10 minutes, you know, questions to discuss, you know what you learned from today's webinar. Have you had known any of this before, you know, or what you're going to do with the information, you know, would you do something differently at your next appointment? Or, you know, would you like to share information about what you learned today with others? And it looks like our group shrunk quite a bit. So if you like, let's, you know, if you want to just speak up now or put a question in the chat, or, you know, we'll be happy to answer any questions or thoughts about today's webinar with anyone. And either you can use the raise hands function or just the chat box there.
Damon, are you thinking we won't do the breakouts? We'll just do.
Yeah, it looks like we only have a handful of folks here. So I think we could probably have a good intimate conversation with the group here.
Okay. So why don't you take down your PowerPoint and we'll just do gallery view so we can see each other?
All right, we'll do that. All right. So if no one else would like to lead off with anything, Iris, I thought that so I thought the patient that didn't want to be touched or wanted to get permission to be touched, I thought that was really great of the provider for trauma-informed care. I know I believe TC mentioned trauma-informed care before as well. That is something that providers learn about these days. That is a very important part of care. If you want to take a moment, I don't know, actually either you or maybe TC, because I think Elaine is on another one, just kind of talk about what that trauma-informed care is when we think about that, just so those on here that may not know about that could understand a little better.
I would just like to say about trauma-informed care that I like that it starts from, you know, a lot of our life we hear about what's wrong with us and what's wrong with people, you know, that aren't so-called normal and all that, and you strive for that being normal and everything. But trauma-informed care looks at, oh, wow, look what's happened to you. Wow, that's why. Oh, let's look at that and see, you know, how we can help you based on that, all that's happened to you, you know. And I like that about trauma-informed care. And a lot of people who think they're doing trauma-informed care still don't start there. They start more, they're still stuck on the what's wrong with you, or why aren't you doing what these people normally do, and why aren't you like this, because people who do this have this diagnosis are like this, and they do this, and they are this.
Oh, there's a question in the chat there. This is informative. Oh, presentation. I learned the difference between a doula and a midwife. I'd like to share all that I heard today with my women's group. Okay, well, thanks, Marianne. I appreciate that. This was glad you got something out of this today. I don't want to steal the thunder from the session about trauma-informed care, but I really think the theme of everything that we talk about, the self-advocating and understanding that communication with your provider is really based around trauma-informed care, understanding that everybody is different, and that there is and that you have to understand, you have to treat them with respect and treat people with respect and understand that their situation is more than just maybe that particular that particular thing that they've come in for at that time, right? And you said it great, TC, that it's not about everybody's not. We tend to want to put everybody in a box like, well, if you have this, you must be like this, right? And they don't understand that there are so many layers to everything. So I appreciate that. Any other thoughts or questions?
And I just mentioned them on briefly because I think what I didn't say, what I just put in the chat, I think is important. When I started doula supporting teens, Medicaid did not pay for birth doula services. So many of the people who were able to have a birth doula were people who could afford to pay for it out of pocket. And so it's been a really, really important health equity improvement, so to speak, in that OHP clients, both Trillium and Pacific Source, have access to birth doulas now under Medicaid. So birth doulas are paid for, they are 100% free, and anyone with the Oregon Health Plan can have a doula for free. So, we really see now that people who otherwise couldn't have afforded that care are really have access now, and it's important to me. And I know I work with Dumas and his colleagues at Trillium to make sure that our doula workforce is culturally diverse, that they speak multiple languages, that they are from our LGBTQ community, or gender non-binary, that we're supporting our trans people delivering babies. So it's important that we see birth doula care as a part of helping our whole communities, because they're now more accessible than ever.
Good. Such a good call out there, Iris. And that just goes to say that just goes to show, like, OHA has the support behind this for particularly traditional healthcare workers in general, right? That is a big part of things now, that and under this under OHA and the health plans. A lot of the health plans have this type of support coming out of them. If they don't have them, not only do they have them, but again, just want to point back that the community-based organizations also have a lot of these resources and like traditional health work, peer support, traditional healthcare worker, the doulas, and things like that, adding support for people. So some people may feel like they don't have someone to go to the doctor with them. Well, there's opportunities and options through community-based organizations, and Lane County is really a great place for that. It's really a good place where there's a lot of involvement from the community-based organizations to push those things forward. And I know from the Tri-County area, just in case we get people from out that way listening to this as well, very much the same there. That matter of fact, they are amazing, and with multiple cultures and languages over there as well. But the object of the game is actually to for from my lens is health equity, the equal access to care, right, and to reduce health disparities, and that a lot of that is about just having that extra support, right? So we're hoping that this training here, I keep calling it a training, this webinar here, just kind of gives you some tools, but also let you know that about some of the other resources like doulas, like peer support specialists that are, like wellness support specialists, and just people that are there to actually help, help advocate for patients, right? And I can tell you in their training, trauma-informed care is a big part of their training as well. I talk a lot, so anyone else want to say anything, please do. I know I run my mouth like a madman. I keep staring in the corner there, but I'm not going to call her out. Lee, what about you, sir? You have anything to add?
I think it was a pretty good webinar. Got a lot of information across and a lot of important information, especially about talking to your doctor and how to talk to your doctor.
Yeah, I appreciate it. So, and also, guys, we're willing to stay on a little longer if need be. If you want, if there's anything else you want to discuss about anything, it may sound like that you guys may not have much more to say. Just want to let you guys know about the next session. Won't be until July 16th, and it'll be about selecting and working with healthcare providers. And you got a little piece of that today, learning that you can switch your provider anytime you want. And hopefully some of the things that TC and Susan and Scott said today about, things that a provider has that should draw you to them, good things about them, their ability to communicate, their willingness to listen to you, and making this a relationship, and not a dictatorship, right? Again, and understanding that you can walk away from that. You don't have to stay in that, and sometimes it saves, it's life saving to do that. Everything is not a good fit. Every doctor is just not a good fit for you. It just doesn't mean they're a bad doctor. It just means it's just not a good fit, right? And that's okay. So with that said, thank you all very much for joining us today. I guess you can leave comments about how bad the moderator was. Like, I hated him, he talks too much or whatnot. But I appreciate you guys coming to join us today. And have a wonderful weekend. We'll see you on the 16th.